And now the next topic is assessment of elderly. The aging cells shrink in size, the protein synthesis slows down, the Golgi apparatus shows the signs of disintegration, and even the mitochondria may undergo fragmentation. That means the aging affects every system of the body. So the assessment is having some component, mainly the geriatric assessment. These are functional assessment, physical as well as clinical assessment, cognitive assessment, nutritional assessment, psychological as well as social assessment, spiritual assessments. So going in detail to these components, we can just go through the principles of comprehensive assessment. So the cornerstone of an individualized plan of care for an older adult is comprehensive assessment. So in this assessment, we will mainly assessing the age-related changes, the age-associated diseases, and the hereditary as well as lifestyle diseases. So, and here we will know the nurses as the member of healthcare team can contribute so much to the team to enhance the assessment process. So here the older adults themselves is the best source of information to assess themselves. So that means this assessment is not just a neutral process. So here we have to assess the ability of the old person, and then assess the disability. Followed by we have to provide appropriate interventions to enhance those abilities, and we have to give appropriate intervention to compensate those disabilities which we have found out. Comprehensive assessment should first assess the ability and then assess the disability, and should provide appropriate interventions to enhance the ability and compensate the disability. Okay, if the old age person is having some cognitive limitation, we cannot give a long task to do. We have to go for task segmentation. We can use so many tools available. Sometimes a complete one tool cannot be used. We have to divide the tool. We have to make it part by part, and we have to use it. That we can use depend upon the setting. Main thing is we have to explore the meaning and implication of health status from older adult perspective. From their perspective, we have to think. We should not focus on performance. We should focus on task capacity, the capacity to perform a task. So that is about the principles. Coming to each functions, first one is functional assessment. So here, this functional assessment is done to identify the ability to perform the self-care, the self-maintenance, and physical activities. One approach is just ask some question about the ability. What all things you can do. And afterwards, we have to observe the ability, whether they are doing the told ability. So disability means we know the impairments or the problems of body related function, body function related, as well as physical, social, as well as attitudinal environment. That is disability. So here to assess the functional assessment, we can use so many tools available. So we will be going through some of the tools. First one is Katz index. So Katz index tool mainly we are using to assess the activities of daily living. So this tool will be using to evaluate the patient's ability to perform the daily personal self-care activities. So what all things the tool is checking? The tool is checking about the ability to bath, to dress, to toilet, transfer, continence, as well as feeding. So I can show one example. This is the tool, Katz tool. So here you can see in activities, bathing, dressing, toileting, transferring, continence, as well as feeding. So here what point we can write here. Only two sessions, independence as well as dependence. Independence means 1 point, dependence means 0 point. That means to bath, the person is dependent, then the person gets 0 point. If the old age person can do the bathing, dressing, toileting, transferring, continence as well as feeding by himself, he will get 1 point each, a total of 6. So if the person is getting 6 points, that means high. The client is independent. So based on this, there will be a scale high to low. Okay, so this is one example of a tool. So coming to the other tool, Barthel index. So this tool is mainly assessing the capacity for self-care. Mainly we will be checking 10 items regarding the feeding, moving from wheelchair to bed and returning, getting on and off the toilet, bathing, walking on a level surface or propelling a wheelchair, going up and down stairs, dressing and undressing and undressing. It is undressing, okay. Maintain bowel continence and bladder control. So 10 items we will be checking. That is Barthel index. And third one is Lawton scale. Here, little more complex things will be checking, like ability to use the telephone, ability to go for shop, to do laundry services, manage financial activities, take medications, proper meals. So little more complex things will be checking with the help of Lawton scale. So OARS scale, social resource scale. So Older Americans Research Service. From the name itself, we can understand these all scales are made by what? The Americans. Not these are not made by Indians. Okay. So commonly these things are not commonly used in India. So this OARS is multi-dimensional tool which is developed by Duke in the year 1978. Mainly it will be evaluating 5 levels, 5 area. Social as well as, one second. Social as well as economic resources, physical as well as mental health and activities of daily living. That is OARS, Older Americans Research Services, which is developed by Duke. By the way, Duke is a university. There is no comma, okay.